today we are speaking on parent support and DBT, and we have some amazing presenters, and I'm going to go ahead and introduce them and then mute myself because I'm a little noisy and let them do their thing. But I do want to let you know that this is being recorded, and if you have questions and don't want to be on the recording, you can just type them in the chat and we'll ask them at the end of the presentation. So today we have Dr. Gillian Galen, who is a child and adolescent psychologist. She is a program director at McLean Hospital's 3 East DBT residential program and the clinical director of Triad Adolescent Services, and is the co-author of multiple books, including DBT for Dummies. We have Jim Holsomback, who is the director of marketing and clinical outreach at McLean Hospital, and he is also the program director at Triad Adolescent Services. We have Dr. Brad Simpson, who is an associate professor and director of the Bachelors in Social Work Department at the University of Southern Utah. He is also the director of research and development at Sunrise RTC and the founder and owner of Third Wave Counseling and Consulting. And lastly, we have Craig Simpson, who is the senior clinical director at Sunrise RTC, where he specializes in DBT consult, supervision, trauma-informed treatment, and experiential therapies. And it's also his birthday today, so wish him a happy birthday. And so I'm going to pass it off to them and enjoy the presentation.
All right, well, thank you so much for everybody for coming. Very much enjoy talking about parent support and specifically around DBT skills when we're talking about a population of kiddos that often have sort of loud and scary behaviors. And what we found over a number of years is that parents are probably the least supported group and often clinical group of folks that we have in behavioral health. We also know that kids typically are more adherent when their parents and their family members are involved in treatment, not just while they're in treatment. They also tend to do better in the community post-treatment when the families are involved. So it's a really passionate thing for the four of us to talk about. I'm really glad that you can be here for the presentation. So part of what we try and do is really try and build up resilient family systems. And at the foundation of that is compassion. And we think about compassion in two ways. One is treaters' compassion for families and sort of that tenet that families are doing the best that they can, and they're doing the best they can when things are going well and doing the best they can when things aren't going well. Then also teaching self-compassion for families, because often families can be their harshest critics, as we all are for those of us that are parents, and to ensure that the self-compassion skills and practices there, again, not just on folks' best day, but also on their worst day. Moving up from there, it's really important to make sure that we have accurate assessment, not just for the kids, but the family system, what they've been through and what their needs are. Psychoeducation, which is also rooted in compassion, and ensuring that when families have sort of a tough spot, that it's that we look at it as a skills deficit and something that we can skill up versus something that parents are sort of pathologizing parents' difficulties, and really making sure that we're teaching and providing the skills that are needed for families specific to the kids that they're raising. We teach empathy, validation, and contingencies, and we'll go over those in our presentation. Disaster prevention, so, easily the least favorite topic to discuss, and really an important topic to discuss outside of the disaster, to make sure that all of that planning is done. When the house isn't on fire, we really want to make sure that we're paying attention to that when it's based in logic versus emotion, and then ongoing support to ensure that families remain supported, not just through crises, but post-crises. It can be a really nice connection for families to feel like they have the opportunity to have a group of, sometimes peers that have been through similar things that they can both benefit from as well as help. We talk a lot about trauma. What we found is that a large majority of the families we work with have sometimes secondary or vicarious kind of witness-based trauma, as well as active PTSD. Just to sort of orient folks, the general population, when we think about PTSD, about 3.5% of the population in the United States meets formal criteria for PTSD. Then we think about some of the higher risk occupations and sort of the percentages of folks that have active PTSD up to and including active military and folks that do child protection work at about 1 out of 3. When we think about families and parents specifically of kiddos that struggle in self-destructive and struggle around suicide, we see active PTSD right around 40%, meaning that we're more likely than not to have, for families that are co-parenting, have a parent with active PTSD. And then when we extend that to secondary trauma, that number jumps to about 60% of families. Secondary trauma, vicarious trauma isn't a formal diagnosis, but we'll go over some of the behaviors and warning signs that'll probably look and feel pretty familiar. In terms of trauma, we know that, I love the sort of the definition. Responses to trauma are normal reactions to abnormal events. When we think about trauma, and we can sort of imagine if we were all, God forbid, together instead of on Zoom, and we witnessed a horrific car accident together as a group on our way to lunch or a meeting or whatever, many of us would, we would probably all sort of register that as a trauma. Some of us would actually, potentially end up with active PTSD. And there's 5 important criteria, 3 of which are really related to parents. So one, is a lack of social support and isolation as a risk factor for eventually developing PTSD. So if we were, in our little group and we were all in the same community and we met, frequently, and we're able to sort of talk about and process, we would actually be less likely to be at risk for developing PTSD because we would have that social support and that shared quality. Second, personal history, family history. So, if we, ourselves prior to sort of witnessing a horrible car accident, were in a horrible car accident, we would have more likely that we would actually have a higher likelihood for developing PTSD. And then, having a longer lasting and continual trauma or not knowing when it's going to end. So if, we all met once a week and it was at a really dangerous intersection that had an accident once a week, we would, again, be more likely to meet formal criteria for PTSD. When we think about our parents of the kiddos that they're raising, we think about how lonely they are and how isolated they often are when their kids are struggling. We think about families that have a history around substance use and trauma. And then we think about, probably the most damaging quality of not knowing when their kid is going to get better. When is the last time that they're going to self-injure? When is their last suicide attempt? And just having that longer continual not knowing where the finish line is and how difficult that is and why so many of our families meet criteria for PTSD. So we think about, sort of what does that mean? A parent that's, that's struggling around the trauma or PTSD and sort of think about the cycles. We have an adolescent who's struggling around self-injury or suicidal behaviors. We have a parent that's going to have, stress around those behaviors. Parents that often are bearing witness to, either directly or indirectly, a life-threatening behavior of the person that they care about more than anyone in the world. For parents, often we see a lot of shame, stigma, fear, anger, suffering, and loneliness. And then we have parents that are providing, based on that, fear-based parenting, and sometimes lacking support or being able to kind of plan for emergencies. So we think about that fear-based parenting. The difficulty is that that parent is still going to be parenting that same adolescent or young adult with the self-destructive behaviors. And what does that actually look like when we have parents that are parenting, based on trauma or based on that fear-based parenting? That's where we get into a lot of our secondary trauma. So on the left, we have some blue emotions. These are just, these are actually the full behavior checklist for 17 of the feelings or affective behavior that we typically see around secondary trauma: fear, hopelessness, guilt, anger, often the most emotions. And we think about those 4 emotions sort of leading to a lot of the behaviors, but most damaging, the ones in purple, leading to diminished self-care, which we see a lot. Families' worlds get really, really small. Their social circles often get really small. The things that they used to do to take care of themselves often fall by the wayside because they're spending more time either suffering, worrying, or taking care of their kiddos or loved ones. Survival coping, chronic exhaustion, and again, social withdrawal. So it's really important that we sort of help, not just teach families a little bit about the likelihood around trauma, but really help them get reconnected, both in terms of the treatment as well as in terms of their social life outside of treatment. So quickly, and then Gillian's going to kind of lead into some of the contingency management. We do spend a lot of time talking about behaviorism because at the root of contingency management really is good behavioral principles, and reinforcement, positive reinforcement, absolutely really important for those that have raised kids. We think about sticker charts and potty training. I'm sure most people have either done or themselves or their kiddos. If you haven't, maybe you're not potty trained yet, but it's a nice way to sort of provide a positive reward. Kids like tangible rewards. When we get into adolescents and teenagers, it tends to be a little more abstract. Trust, freedom, love, intimacy, relationships, and autonomy are really helpful in terms of those rewards for adolescents. Negative reinforcement, we often use that term negative a lot. All it is just sort of removing something that somebody wouldn't want. It doesn't mean bad at all. And removing things like parent nagging, reminders, controlling behaviors. We think about sort of like when you get in your car and the seatbelt alarm goes off because you haven't put your seatbelt on. That's negative reinforcement. It's actually increasing the likelihood that we put our seatbelt on because we're removing the annoying dinging sounds. We try and stay away from punishment. Unfortunately, I think often when we think about eggshell parenting or parenting where the parents are just sort of fried, punishment's an easy direction to go. Often, punishment sort of teaches how to get away with the behavior more than it does actually changing the behavior. We want to make sure parents understand that the extinction bursts will happen. So often the very behavior that we're trying to lower or remove actually increases in the short term, and how important it is to stay consistent with all of the behavioral principles and contingencies that we've set up. And finally, reinforcing as we get closer to the goal. And this is a really important one. If we have behavior that's happening every day and we sort of get that behavior down to happening once a week, it's really tempting to focus and pound away at that 1 day a week and sort of ignore the 6 days where that behavior has diminished. And we want to make sure that we're paying at least as much attention to those 6 days or when those positive changes happen as when the behavior that hasn't quite changed yet actually occurs.
All right, so I'm going to jump in now around contingency management. So we in DBT talk a lot about this idea that contingencies build capabilities. So, when you set a contingency, you are trying to figure out a behavior that you would like from the other person, something I'd like them to do, for example, like getting better at coming home on time for their curfew, sharing more information, following through on responsibilities, maybe decreased mood-dependent behaviors in certain areas of their life. And so you sort of think about when you set contingencies, you want to set the bar for the behavioral target and that expectation really like just above what the person thinks that they can do. And then, so it's just slightly out of reach. And then we often use our principles of reinforcement, positive or negative reinforcement, to help that person reach the bar. So help them realize they can do something that they don't actually think that they can do. The most effective contingencies follow this little acronym called cliche. So the key about contingencies is that we want them to be consistent. Okay, so we know for people that have studied behaviorism that we get into trouble when we do what's called intermittently reinforcing something. So we set an expectation and then we don't follow through really on whatever the consequence is, right? So sometimes there's a consequence, other times there's not a consequence, and you get what's called intermittent reinforcement. And really it sends the message to the person that they don't really need to reach that bar or that expectation because we won't always hold it. Now this happens to all of us. All of us do this. I do it, Jim does it, even though we understand this. But our idea is to really set contingencies, knowing that we have to be consistent, and that this is where we move down the acronym to livable. We need to set contingencies that we actually can follow through on. So when we set contingencies, we never set them in emotion mind, as absolutely tempting as it is in those moments. We need these to be really a wise-minded decision. It has to be livable, right? So if one of the contingencies involves something like, if they don't meet the expectation, they can't have the car for the week, and you need your kid to have the car to drive back and forth to school, to get to appointments, to drive siblings around, that's not going to be a livable consequence, because then you're going to need to do that driving around, and it's going to be very hard to be consistent. So we're not only consistent, but we have to be really thoughtful about what's a livable contingency, one that we can hold and one that we can live with. Okay, it has to be intuitive. This is the creative part of our contingencies. And you know, the biggest pitfall that we see a lot of the parents fall into is that everything is related to the phone or technology, because it feels in the moment like that's the absolute only leverage that we've got. But the goal of contingencies, it's not about punishment, right? It's about using reinforcement to help somebody change a behavior, okay? So if you can think a little bit like it has to make sense, right? So not, you have a adolescent that drives and who's not coming home on time, right? Not meeting their curfew. Taking their phone away really may not make, that doesn't make sense. It's not intuitive, right? However, if there's problematic phone behavior, right, then maybe some of the reinforcers are gaining more, more phone time, and having it related to the phone. So it has to be intuitive. We want this to like make sense, because otherwise you're like, well, you get from the adolescent like, oh, you're just going to take away my phone again. I'm going to take away all of my technology. Okay. So we want it to be intuitive. We want it to make sense. We want this to be collaborative. Now, not all contingencies need to be collaborative. Sometimes we have to extinguish behaviors, and so we set contingencies. But the most effective ones are collaborative. We all sit down at the table and we say, look, we need you to get home more close, on your time at your curfew. We need you to be home by 11:30. We understand that you want to stay out later. What are we going to do to help you get what you want and us get the behavior that we want? And what's really interesting is a lot of times when you bring kids to the table and set something collaboratively, they may not be thrilled about it, but often they're quite creative, and they're going to be more engaged if, again, it's intuitive and if they have some role in it. So we allow a little bit of negotiation to help support collaborative contingency management. We want it to be holistic, right? We want it to be something that makes sense to everybody, that sort of covers all our bases and that everybody understands. And then we want it to be established, okay? The wonderful thing about setting contingencies is that all the legwork is done at the front end, right? So good contingencies, particularly collaborative ones, everyone knows when the problematic behavior shows up, everybody knows what happens. So when they come home late, they already know that they're not going out the next weekend, right? So we get away from having to do that reactive, oh my gosh, like what's the consequence going to be when we're already, anxious or upset or scared or angry. And then we sort of lay down a non-livable contingency. Everybody knows what's going to happen, okay? So it actually makes those moments that are more difficult actually much easier, because the work has been done on the front end, and it's like, okay, this is what it is, and it becomes much easier to be consistent. So the next tool that we really focus on is validation. We've got a little video, two videos to talk about validation. Validation is going to be one of, in a lot of ways, this is going to be the tool that is going to be, for many parents, one of the most challenging to learn, and it's going to be the most powerful in terms of setting your contingencies, right? We know that using validation before setting contingencies and saying no is much more effective. Validation is your skill that builds relationships. Validation is simply recognizing the other person's emotional experience and that it makes sense, okay, given who they are. So we're going to watch a little 2-minute video and then talk more about validation. You don't have sound, Jim.
You stop sharing it and then resharing it, there's a little box that pops up that asks if you want to have the audio, and you just got to click that. So if you want to share and then reshare, it should pop up for you.
Thank you.
And I can just feel it, like literally feel it in my head, and it's relentless. And I don't know if it's going to stop. I mean, that's the thing that scares me the most, is that I don't know if it's ever going to stop.
Yeah. Well, you do have a nail in your head.
It is not about the nail.
Are you sure? Because, I mean, I'll bet if we got that out of there...
Stop trying to fix it.
No, I'm not trying to fix it. I'm just pointing out that maybe the nail is causing...
You always do this. You always try to fix things when what I really need is for you to just listen.
No, see, I don't think that is what you need. I think what you need is to get the nail
See,
out.
you're not even listening now.
Okay, fine. I will listen. Fine.
It's just, sometimes it's like, there's this achy, I don't know what it is. And I'm not sleeping very well at all. And all my sweaters are snagged. I mean, all of them.
That sounds really hard.
It is. Thank you. Ow!
Oh, come on. If you would just...
Don't.
Try to see things my way.
So, so crash course in validation. We talk a lot about validation in DBT. It is part of our give skill. It's part of our relationship effectiveness. And when, I think many people on here are probably very familiar with validation, but here's some things that are just some key points about validation. So when we validate, we're listening to the other person, we're taking their perspective, we're truly looking for the wisdom in their point of view and their emotional experience given who they are. So if you have an emotionally sensitive child, their reaction, which may be bigger and longer and deeper, may make sense given who they are. Right? We're genuinely curious. Okay. We use and or at the same time. So we use our dialectical approach. We come from empathy and compassion for the other person's point of view, even when we disagree. We state things tentatively, okay? So this is really all about the other person's experience. And we recognize that the other person is an expert in their own experience. All right, when we struggle, these are great things. So pay attention to these because certain ones will will sort of fit each of us differently. So when we struggle with invalidation, we do things that maybe diminish safety or make threats. Okay, and this is often something that comes from kids. This is often one of the things that kids may do that can be very invalidating for parents. We assign intention to the other person's point of view. We give advice or we fix problems. We use words like but. We are controlling, right? We get a lot of willfulness. We don't accept the other person's thoughts or feelings. We think that we're validating, but we act from a point of view of absolute certainty or judgment. We use shoulds and justs. So at the end of the video, you saw that if you would just, that's a great red flag for we're struggling with some validation, right? Maybe we want to win or we want to lead the conversation in a certain way. We have an agenda, so we lack that genuine curiosity. We treat the person as fragile, right? We're multitasking and not paying attention. Or we fall into validating the invalid, okay, which can be a really tricky thing where we need to remember to go to the emotion and not get caught on the thought, okay, or the belief. So this is a quick video that we have more recently found that I think is really helpful for people to think about the difference between sympathy and empathy. And this is the difference really also between sympathy and validation.
So what is empathy, and why is it very different than sympathy? Empathy fuels connection. Sympathy drives disconnection. Empathy, it's very interesting. Teresa Wiseman is a nursing scholar who studied professions very diverse professions where empathy is relevant and came up with 4 qualities of empathy. Perspective taking, the ability to take the perspective of another person or recognize their perspective as their truth. Staying out of judgment, not easy when you enjoy it as much as most of us do. Recognizing emotion in other people and then communicating that. Empathy is feeling with people. And to me, I always think of empathy as this kind of sacred space when someone's kind of in a deep hole and they shout out from the bottom and they say, I'm stuck, it's dark, I'm overwhelmed. And then we look and we say, hey, climb down. I know what it's like down here. And you're not alone. Sympathy is, ooh, it's bad, no. You want a sandwich? Empathy is a choice, and it's a vulnerable choice, because in order to connect with you, I have to connect with something in myself that knows that feeling. Rarely, if ever, does an empathic response begin with at least. Yeah. And we do it all the time. Because you know what? Someone just shared something with us that's incredibly painful, and we're trying to silver lining it. I don't think that's a verb, but I'm using it as one. We're trying to put the silver lining around it. So, I had a miscarriage. Oh, at least you know you can get pregnant. I think my marriage is falling apart. At least you have a marriage. John's getting kicked out of school. At least Sarah is an A student. But one of the things we do sometimes in the face of very difficult conversations is we try to make things better. If I share something with you that's very difficult, I'd rather you say, I don't even know what to say right now. I'm just so glad you told me. Because the truth is, rarely can a response make something better. What makes something better is connection.
So just a quick end sort of point. So really, I hope you can think about that difference between empathy and sympathy and validation. We all fall into some of those holes. So, what do we want to do? What are some general guidelines? We want to set a good example. We want to learn skills. We want to practice skills. We want to apologize when we make mistakes. We want to know where the kids are, what activities they do. We want to know something about their friends. There's lots of data on eating family dinners. Obviously, can't do that every day, but as much as you can, there's sort of some nice data on that in connection. Set fair contingencies, use that cliche model, understand that it's a work in progress. It's not going to be perfect. You can always rework contingencies. You can come back a couple weeks later and see how they're going. Work to maintain open lines of communication. Validation is going to help that, right? The thing that is, there's really nothing scarier than when we don't know what the behaviors are and they start to go underground. So really invest in validation and communication. Take care of yourself. Parents who take care of themselves, their kids tend to do better. Learn about signs and symptoms of self-injury or substance use or different struggles with behaviors that your kids may be doing, and look for relapse. Think about signs for relapse and maybe talk with them about it. And design a plan for when things go well as when they don't go well. So we tend to move into sort of a defensive stance a lot and lots of planning for the worst. Make sure we're reinforcing when things go well, that we're celebrating successes and not just focusing on difficulties. Pass the screen over.
Thank you. We'll get the share going here, and then you'll be able to see how we're doing. But I just want you to know I was taking notes as a caregiver for this presentation and a parent. So thanks for the help and the tips. I actually just had a similar instance with my daughter today. And you're right, I always go to technology. And I'm like, okay, give me your phone, right? And she's like, it doesn't have anything to do with the phone, but that's where I go every time. So thanks for helping me. I'm still working on applying all these things that we know and learn and do. And in every context, I have to apply my skills. So thanks for sharing. In DBT, we talk about the philosophical assumptions. And so I just wanted, as we kind of talk about dialectics and understanding dialectics, it's just good to know the philosophical assumptions that we use in DBT. So when you think about kind of that behaviorism, right? We talked about contingency management, behaviorism. We also know that behaviorism is one of those on the triangle. If you think of a triangle, it's one of those sides that we look at. The other side is the Zen practice or Zen philosophy. And then kind of this underlying piece to it all is the dialectical philosophy. And that's what we're going to focus on a little bit, is the use of dialectics and how that helps us as caregivers and parents, but also how that helps in regards to the adolescent who's going through the treatment and through the therapists and those that are involved that way. And Craig's going to talk more about those.
Right. I'm going to skip ahead through some of this and just, we kind of know the dialectics, the statements, and just wanted to focus more on our common parenting dialectical dilemmas that we kind of see. So these are taken from kind of the Miller and Rathis book for teenagers, and they're the ones that kind of came up with this the best or put it into words. But we kind of focus on those typical parenting dialectical dilemmas. And I was reviewing some of this, and I love how they kind of framed, these are some of the secondary targets that we work with adolescents. And the secondary targets are behavioral extremes that they use to underregulate or overregulate their emotions a lot of the time. And so they get stuck in those. And I love applying that to parents, because each extreme represents an attempt by parents to either increase an adaptive response or a more adaptive way of doing something, or decrease a maladaptive behavior. And you're kind of stuck in those two dialectics as a parent all the time of trying to, how do I help decrease the self-harm behavior that I'm seeing in my son or daughter? And the things that Jim and Gillian shared were perfect, and being able to kind of do that and identify, even for parents, kind of how they fall on those dialectics. And really why they're so important too, is if we're not addressing them and we're not able to kind of help resolve them, they get in the way of skills acquisition. They interfere with the therapy as they go on. And then they have an overall bigger impact on the family, student, and parents' targets for change. So one of the biggest ones is first the developmentally typical behaviors, or addressing problem behaviors. And so looking for the balance between those. And a lot of times it's funny, I love teaching this with parents and teens together, because the teenagers are always on the one side, and they're looking at what their friends are doing, and that's what determines what's normal and what's developmentally appropriate for them, because their friends are doing it. And then we have the parents on the other side, for the most part, who are just scared to death of what their teens are doing sometimes, or what their behaviors are. But sometimes it gets really hard to tell the difference between what's typical and what's okay. And so there are a lot of hints that we can kind of go through. So taking into account their age, the familial kind of culture, the community culture, their religion helps you determine, their individual's history, their vulnerabilities, their risk factors. And then the biggest things that we look at are when a behavior pattern significantly impacts functioning, continually relates back to other target behaviors, and repeatedly interferes with participation in life, in group, and the things that they're trying to do, then you can apply those 4 things, or kind of it's 5 or 6 things, to really help you know this is not normal. This is not normal behavior. And it does need to be addressed. And so then it's coming up with the contingencies and how you want to manage it. It's also coming up with contingencies for parents. How do they know when they've kind of found themselves stuck in a dilemma? How do they identify that? And we'll kind of talk about that more. Being strict, being too lenient. So sometimes, like in a culture, if you looked at the culture of a family and you have the helicopter parent and the tiger mom, and the subculture is the increased independence and decisions, desire for privacy, average grades, spending time with peers, all might be discouraged despite being normal teenage behaviors. And then on the opposite, it can be in other cultures that it's it was comparing European culture, and one of the things that I was talking about, where it's more normative for teens to go out and drink with their families during dinner or those kinds of things, but being able to use that to kind of inform what's going on and kind of how to look at that. Let's see. So we kind of have, these are our typical dilemmas. So we talked about normalizing, pathologizing normative behavior, fostering dependence, forcing autonomy, excessive leniency, authoritarian control. And these are just some great questions parents can ask themselves. This is where I am, and this is where I want to be. If I took this along a continuum, where do I appear on the normalizing pathologic behavior and pathologizing normative behavior? Or being too lenient or being too strict? Where do I fall and where do I want to be? These are the situations that drive me to one pole or the other. And having families kind of write this down as they're developing that plan with their student as well. And being able to really say, when you cut, I find myself in this place immediately. And these are the emotions that I'm experiencing. And this is what hijacks me in those moments. And then you get the reactive parent out of me. It helps we set emotions. Here are the situations where my partner probably needs to be tagged in. So this is very important in helping parents kind of come up with, everybody's on the same plan, but then coming up with a division of duties. Some parents are so much better at one parent is so much better at dealing with certain behaviors than other parents sometimes. And being able to identify that and utilize that as a strength, but also backing each other up in those moments. I'm most effective, I'm least effective as a parent when I am, and looking at those. And then these are activities that help me move toward the middle. And that really is looking at the skills and the skills base, and how do I get myself back to, a lot of time it's that wise mind, and how do I get back to my wise mind so I can be effective at the time. So then, so for the first one, it's the normalizing and pathologizing. It's just seeking out family support. When adolescents and young adults understand the associations, it helps kind of the family anxiety decrease. And when you kind of had these conversations ahead of time and made the goals, it helps just create clarity. Building the contingencies, helping build healthy young adults, it builds capabilities and autonomy. And I love that Gillian pointed that out, of that contingencies should build capabilities. They shouldn't shut us down. They shouldn't be built around us to stop us. They should help us become more capable and work harder and more effective. And then the last one, just parents taking care of themselves, taking care of each other's, co-parenting, finding the balance. Those are really kind of key components. A lot of the times the students that I see and that we see here, parents have gotten far out of balance. They've been living in that trauma cycle for a long time and have been to the hospital multiple times and have tried so many different things that their parenting starts to go all over the place, where you have parents like sleeping at the foot of the bed to try to keep their daughter alive, or taking away everything in their room and leaving them with a sheet and a blanket, or just all those kinds of extremes that you can get into are very important to look at and kind of start to build up parents to be able to find ways to get out of that as well. And then really, I think we're on to Brad now.
Yeah, I think it fits well. I'll just share an example of kind of one of those extremes. I had a mom, we're going to talk about kind of the DBT assumptions and how those help us and guide us in our parenting with our adolescents. But I had a mom, and I love this example. She every day would write in her journal and give herself a grade of how she did as a mom. And you can guess that she was living on extremes and trauma, no question. But the grade she would give herself, I don't think I ever saw an A grade, right? It was often an F, a D, and a C. And then she would write exactly why she got that grade. And so when I think about kind of living on those extremes and that need for self-care and support for the caregiver, the parent, it just solidified for me and for her. You know, she was able to do some really amazing work in regards to trauma she'd been through, but then also she was able to shift and build in some of those pieces that allowed her to really not live on the extreme with her daughter and with herself and that own self-care. And so it was amazing to kind of watch that transformation. She even, as one of the things she did to kind of move from that, was she took that journal and burned it. And that was really a representation of her, that I'm no longer going to subscribe to these extreme thoughts of criticism for herself and self-doubt, and the things that really helped her. And so it's interesting that for her was a really big part of what I'm leading to, is this idea of the DBT assumptions. And the DBT assumptions, Craig, if you'll jump down about 3 or 4 slides, there's one that talks about families, or gives the assumptions for families. But these DBT assumptions, really her burning that journal and being able to move from this really critical stance with herself, she started to buy into these assumptions that we ask people to adhere to. And the reason we do is because these assumptions allow us to be more effective in our parenting, work towards that main goal that we're working towards of helping ourselves and our daughters create a life worth living, and really allows us to take those stances so we're not going to the extreme so much. And she really did. It was amazing to watch her. And some of those assumptions that we ask people to use are, and this could be said however you want, depending on who you're talking to, but for this mom, it was that I'm doing the best I can, right? And that was a really important one for her. And that was powerful. And it didn't come overnight for her to be able to say, I'm doing the best I can. But she started to work at it and be able to adhere to that. And then this other one that our families, our daughters, ourselves, we all want to improve, right? And that's kind of the idea. So we make that assumption about our daughter, our adolescent, whoever that might be, young adult, whoever you're working with. We make that assumption because it allows us to always know that they want to improve. They're doing the best they can. And then I love this next one, kind of works off of that, but this idea that you need to be better, try harder, and be more motivated to change. So it's both, right? You hear the dialectic on the one hand, that I need to do better, be better, and try harder, and I'm doing the best I can. Both can coexist, right? And allowing those to coexist actually allows me to find the middle path, and rather than working from those extremes. The other one is families may not have caused all their problems, but they do have to solve them anyway. That's the same for myself. That's the same for my daughter, whatever that might be. And then the lives of our child is unbearable as they feel it is in that moment. So it truly can be unbearable in this very moment, which actually my acceptance of that allows me to then do something with it, rather than take this passive acceptance that it's unbearable and nothing can be done. And then the other assumption is that we must learn and practice all behaviors in different situations in our lives or contexts. You heard me kind of give you a little self-disclosure for myself that here I am trained in DBT, and I still have to practice it in all contexts of my life, whether it's clients, my family, my daughter, in my own parenting. I'm still working to practice that in every context. So every behavior, every skill has to be learned in every context. And then this idea that all behaviors are caused, right? And so we're aware of that. And then figuring out and changing the cause of behavior works better than judging or blaming or taking things in a well-meaning way rather than assuming the worst. So it's really that idea that as we look at the cause of the behavior, we analyze it, we try to understand why it exists, all behavior is caused. That actually allows me to do something with it rather than take this judgmental stance. And you'll hear this sometimes, as I work with, I do a lot of supervision, that kind of work. I'll hear sometimes, well, the client just doesn't want to even try anymore. They're not even working anymore. And when we say things like that, or as a parent, I'm like, my kid just doesn't even care, right? And when we say that, we've rendered ourselves ineffective, because if we really believe that, that also justifies and gives us a reason to not try or do or look at what the causes of the behavior are. And so that's kind of the great advantage of that assumption, is it really allows us to look at, okay, how is that rendering me ineffective, and how can I change my assumptions so that I can look at the cause of behavior and then help me do something different, which in turn will help my adolescent do something different. And so that's really the other piece. And then this other one is that families and students cannot fail in DBT. We just keep working at it. It's a practice and it's something we work at. And we continue to do the best that we can. So I hope as you kind of see all of this come together, it makes sense and it ties together for you, how these all really build upon each other to help us really be and provide the best care for our families and our adolescents and for ourselves in this process. And I know we've got some question and answer portion, Tracy, so I'll let you kind of take that away.
Yeah, I'll ask one that was given to us during registration, and then if anyone in the audience has any, we'd be happy to hear them. Okay, so the first one is, when working on a specific skill at home with my child, how can I balance this work when I have other kids at home and they are not actively or needing to work on DBT skills? Anyone can answer.
Tracy, can you say it one more time for me?
Yes. When working on a specific skill at home with my child, how can I balance this work when I have other kids at home and they are not actively needing to work on DBT skills?
I'll jump in too real quick, maybe, if that's all right. A little self-disclosure, I have 6 children at home. And so you can see that it can be a little overwhelming. Here's what's remarkable is we all need DBT skills. And so when I'm thinking about, man, I need to work on this with my child who needs DBT skills, the great news is that transfers to all my other kids and it helps me be more effective. But also in the process, it's amazing as I'm using my skills and trying to practice those, it then allows me to work with my child. I may be focused on the moment, but my other children actually start to hear that and learn that, and they start to learn that language in the process as well, and also start to learn that, hey, that was pretty effective, I'm going to try that, and they start to pick those things up also. So I found by not limiting it to one person has actually really allowed and helped me to be more effective in all the other ways. And I'll be honest that the child who tends to be most difficult is probably the one that teach me to be a better parent with my other children, right? And helps me to do a better job that way. So I think those are areas that's been helpful.
We have one in the chat unless anybody else wants to say anything about that one. Okay, can you provide some samples of contingencies that other than phone and screen time for grounding kids? Oh, sorry about that.
I can take that one. Yeah, so grounding kids generally isn't a contingency management. So contingency management works on reinforcement, which is usually works, most of the time it works on positive reinforcement. So the idea that if they do the desired behavior, they gain something. And if they don't do the desired behavior, they don't gain that, which they can feel is sort of punishing, but it's not directly taking something away. The goal is to be gaining it. So I work with a lot of parents that need to work with their kids around like coming home at reasonable hours. So if they have like something has happened and they're now stuck at home on Saturday nights, they have to be home at 10 o'clock and they think like that's so terrible and unjust. And I want my curfew to be 11:30 like all my other 17-year-old friends. I might set a contingency that says like, okay, if you can come home on time on our agreed time, like weekdays and weekends for X amount of time, for let's say 2 weeks or some number of days in a row, then at the end of that, I'm gonna increase by 15 minutes, right? So I might increase from 10 to 10:15. If they don't come home on time, they don't go backwards. They just stay exactly where they are. Okay, so you're just not moving, you're not providing the reward until they do the desired behavior, right? So they may be stuck at 10:15 for a long time, and then they will realize that if they continue to meet that mark, then I'll keep moving up, by 15 minutes, and then they'll get, reasonably quickly, they can get to where they need to go. If they fall back and they're late, then they just don't move up. So that would be an example of a contingency. So it's not taking things away, it's figuring out what somebody wants. And then when they do that behavior, we reward it. And when they don't do it, we just stay exactly where we are.
Anyone want to add on? All right, are there any?
Actually, one quick other thing is that you need to remember that the reinforcer has to be something that the kid wants, not something that we think the kid wants, or that not something we think the kid ought to want. you need to, that's where you want to be collaborative, and you want to see, you know, they may say, well, it should increase an hour, and then you may be in a little bit of a negotiation to get to where you need to be.
And I think in addition to that, and you know, kids are great contributors to that. You know, sometimes saying, you know, what is it that you want, and not that you know they get to go to, you know, Disney for cleaning up their room for one day, but being able to kind of, you know, have them be part of the reinforcer selection certainly brings them to the table in a nice way. And I think often doing a checkpoint, you know, 2 weeks, 3 weeks, when things are going well, when things aren't going well. So, you know, we can kind of establish and evaluate, okay, this contingency is really effective. Maybe we can change or alter or kind of put the carrot out a little bit further. This one, you know, we thought we didn't, you know, we had established with really good intentions, and it's just not working in the way that we thought. So let's establish it, but to do that in a thoughtful way at a design time versus this isn't working, let's blow it all up and start all over again. An emotion mind can be really, you know, it's a difficult way to sort of do things. And then, you know, it's sort of like, well, how important is the next plan going to be if it doesn't work for the first or second time?
Can I take one of the questions in the chat? I love it.
Do you want me to read it, or would you like to read it?
Oh, I can summarize it. I can
Go for
it. So one of the questions was suggestions for prioritizing teaching specific DBT parenting skills or concepts for shorter term care. I would say teach validation, principles of behavior, ABC please skills for the parents. Like, not about get your kid, stay away, not about like get your kid to do these, but actually get the parents to them, because usually they're terrible. They're usually their ABC please skills are like almost as bad as the kids by the time they get to us. So those are, I mean, I don't know what other people would say. I would say those three, and you know, the parenting dialectics are probably the four that I would prioritize, like if you're looking at a 2 to 4 week program. But I don't know what Jim or Brad or Craig, you guys have a different series of skills you'd want to teach.
I would agree, and really the validation, kind of the only thing I'd add is be like the interpersonal effectiveness skills of kind of teaching them some of those pretty quickly. So.
Okay, it looks like the next question is on written reward plans and how and when to use them.
At least from me, like when we look at these things, I think it's having written out, and we spend a lot of time here writing out what's the plan going to be from home, what are the rules, how do we have that all set up ahead of time, and then using kind of their behaviors and kind of training and things to help them do more specific things that they want to work on with the kids. And so sometimes it's knowing your kid. And if I know a certain kid, I know I'm going to have to give rewards more frequently. And sometimes I can get away with doing less frequent rewards, but it's all about kind of shaping that behavior and where I want it to go. And so being able to make it, you'll find, especially with younger kids, you have to keep it novel and new and keep their interest in it. And because they'll lose interest pretty quickly in things. So you have to switch it up to 1 week we're using poker chips as a token, or the next week we have to switch it up to a different kind of contingency that will help them. So that's my answer.
Yeah, I just add the written plan also helps the parent and the caregiver, because I find myself when I'm in emotion mind, all good parenting skills go out the window. So all my in terms of context, when I think about my ability to use skills, my effectiveness is diminished. And so having a written plan also helps me come back and remember, okay, I've got it. I already thought through this, right? And I find that's really effective for parents and makes a large difference for them, so they don't forget those things that they also agreed to. You know, and sometimes their adolescent has to remind them, but that's a lot harder than just looking at the plan. So
yeah, and the one thing I would add is call it a plan and not a contract. Like there's the contract gives you like no flexibility, like write a plan and then circle back in say like 2 to 4 weeks and think about like how the parent and the kid are holding up the plan. And if you need to like edit or amend or like trash the plan and start over. Because I just think the idea of a contract, there's really no evidence for contracts working, even contracting for safety, there's no evidence that that actually works so well, but like the contract seems so final, and I think it just cranks up everybody's performance anxiety around it.
We have one final question in the chat, which Jim is answering in the chat. So I'm going to give one that was sent in registration for our final question. How are you working with families from different cultures? I picked a hard one for the last one.
That's great. I'll let Craig maybe speak to that, but I liked what he talked about in regards to the parenting dialectical dilemmas, and that understanding of different cultures will have different things that can be normative or typical behavior. And so I think understanding that's a really critical component. And then just very much that collaborative, that collaborative nature of really being able to understand and making sure that we have, parents helping us understand culturally how they are influenced and impacted in those areas is really critical. And Craig can maybe expand on that.
I would really just say it's using kind of our skills anyway, of just being curious and asking the family, and don't assume when they're from a different culture that the culture that you know or understand is kind of how you understand it. And so asking a lot of questions and finding out, how did you grow up? How did this be dealt with in your family? And what's kind of teach me a little bit more about your culture. It's one of my favorite things that I've done throughout my career is just, I've worked with refugees, I've worked at all these different places. And I love getting to learn the differences and how they act, and things that would be totally normal for them. They come here sometimes and it's illegal, the things that they've been doing or they've wanted to do or how they've lived. And so just figuring that and educating yourself, and really they're the experts, and letting them kind of tell you and guide you through that process is all that I would add.
Yeah, I would totally agree. I think from my experience, really it's the interpersonal effectiveness skills that are the ones that you often have to focus on the most, because they really are they don't work in a lot of cultures. There's a directness that is like a very American, very kind of white American nature to them. And so I think that we've often had to kind of adjust some of that because they just don't work. It's not something that is going to be really supported or effective with specific cultures. So we take a lot of feedback and are try to learn about what are some of the skills that we need to be more thoughtful about, and get help with thinking about how do we adapt those to be more culturally specific.
Well, we are right on time. Do any of our presenters have any final thoughts that they would like to share with us? No,
I'll just say thank
smiles.
you. It's been awesome to see many of you, and we know many of you that are on with us. And so thanks for being here. And anyways, great to join with everybody in this.
Likewise,
Thanks for
we'll
attending, everyone. Sorry, Jim.
That's okay. I was going to say likewise, thank you. We'll make sure the slides get out. Thanks so much for attending. Sorry, Tracy.
All right. Have a great day.
Thank you, everyone.
Thank you.
Thanks, guys.